On the third anniversary of Ayushman Bharat program, the State National Health Mission organized a one-day sensitization workshop on the expanded range of services for delivery of comprehensive primary health care through Ayushman Bharat Health and Wellness Center for state nodal officers and district nodal officers today at Moria Institute of Integral Training, Shillong. Shri A.L. Heck, Minister of Health and Family Welfare, graced the occasion as the chief guest in the presence of Shri Ram Kumar, Mission Director, National Health Mission, Dr. R.F. Taryang, Director of Health Services, MCH and FW, Dr. S.S. Nongri, Joint Director of Health Services, MCH and FW, come State Nodal Officer, CPHC, and Nodal Officers of various programs. Speaking on the occasion, Shri Hek applauded the frontline workers of health and wellness centers who made these 3 years of comprehensive primary health care a successful one. The minister also highlighted the importance and scope of preventive and promotive health care through the health and wellness centers in various parts of the state to ensure universal health coverage reach to every citizen of the state. Shri Hek also urged the health officials to intensify the awareness campaigns on various health issues and motivate the people of the state to come forward and register themselves with the Meghalaya Health Insurance Scheme to enable them to avail the financial benefit provided under the scheme. Shri Ram Kumar, Mission Director NHM, in his speech stressed on the quality service to be delivered at health and wellness centers by the constant skill building of frontline workers. He also emphasized on the needs to provide these services to the community by system strengthening. The Mission Director also appreciated the efforts of State District, CPHC team and technical partner into operationalizing health and wellness centers. During the function, the Health and Family Welfare Minister released a coffee table book which captures the AB Health and Wellness Center's journey in the state since 2018, along with 12 essential packages of service posters and a testimonial video. The minister also felicitated the best performing health and wellness teams under various categories where West Garo Hills district was awarded the best performing CPHC district. Others who spoke on the occasion are Dr. R.F. Taryang, Director of Health Services, MCH and FW, and Dr. S.S. Nongri, State Nodal Officer, CPHC, who highlighted at length about Ayushman Bharat Health and Wellness Program and its achievements in the state. The topics for day-long workshop includes orientation of CPHC, ABHWC, expanded range of services for delivery of CHC through ABHWCs and action plan for 2021 to 2022 presented by State Zonal Manager, CPHC and technical partner team.
Who leads the health departments. I'd like to share with you, I have full faith on confidence in all the workers of the health department, right from the principal secretary, all the directorates of DHS, all the mission director, the joint secretary, and all the staff working right up to the sub-center levels. I have full faith and confidence. You don't believe I never interfere with the activities, the services been done in all the hospital, the administrations and everywhere. I just want to share with all of you when they have given farewells meeting to 2 SDOs under the health engineering way. One of the SDOs, which is my neighbor, she has been residing in my same locality with me, Mr. Dhar. I know him personally because he was in my constituency when the Bharat constituency was not delimitation at that time. It was for under my constituency, the RR colony also. So I know him right from that time. Then the other SDO, which was given farewell and that day, I never seen him. I don't know his number, but I never called him also. That is the way of my functioning. Now I'm not interfering into the day-to-day functioning of the health department. But always my intentions, my requirements and desires from all our health workers. We need to give the best services to the people. How to reach out to the people. At the same time also, we are not working only with our brain and our intellect, whatever we have in our intellect, with our intellect, but we have to work also with our hearts. The Ram Kumar categorically mentioned about the solutions. We are in the health department. We are here to impart solutions, not the problems. When the patients are coming for consultations to any sub-center or the PCCC or the hospital, it's our bound responsibility and our duty to ensure how we give solutions to the patients. The important is the psychology, how we attack the psychology. Many of us, we always, don't take me otherwise to me. When I speak with my heart. Don't take it otherwise. I don't want to see that we are only performing our duty. We want to see that we are performing our duty from our hearts. We touch them. It goes to their psychology, to their heart. How to impart services, how to impart our consultations, how to giving the clinic treatments to our patients. This is our bound duty and responsibility of health department. Since I am not interfering, doesn't mean that what is happening, it don't mean that I don't know what is happening in the health department. Sometimes it's happened, and it's happened to me also. We are human beings, we having our egos. But when we are doing a service to the people, we should bury our egos. Egos cannot rule us. We should rule our egos by us. We should take that responsibility. I have never, when I walk in the health department, I have faith and confidence in our captains. In HM we have a captains, directorates we have a captains, in the health department we have captains, we have captain in the medical superintendent, we have captains in the joint directors, we have a captain in the DMHO, we have faith in them. That's why I am also a non-technical man. I will not be able to tell you about how the services you are imparting to the patients. But a non-technical man, we have faith in you. But I want you, all of you, to have a heart. A heart is more important than your intellect, than your brain. We need to impart our hearts to them. We have to give the sound psychological impact in our patients when they come for any consultation. They have come for any kind of set of services which we need. Today we have seen the testimony which has been given by our just video released just short while ago. Some family were very happy for the mother and child health. When they go for their delivery, it is institutional delivery. It has given the confidence to the people. And important in our health sector is awareness. How we are imparting awareness. I am telling you, I have been seeing so many hospitals, whether it is in the states, it is outside the states. When our doctor, when we went for the consultations, if we saw their behavior, we saw their attitude,